Today I will be discussing one very important topic, how to cope up as a parent when your child is diagnosed with a liver disease. So it's definitely very scary when a doctor you see jaundice in the eyes of your child, or you're finding that okay, it is urine is always yellow colored, body is looking yellow. You immediately know that something is not good with the liver. And when a doctor tells you that okay, your child is suffering from liver disease, it's a kind of shock for all of us as a parent, because we know that liver can be very bad many of the times, because whatever we have seen in our environment, with our personal experiences, or what we listen in the society. But few things parents must understand, that whenever your child is diagnosed with a liver disease, the prognosis or the outcome is not always gloomy. Most of the times whenever we find liver disease in a child, many of the times this is acute viral hepatitis or acute liver injury, which gets better by itself. Liver has a very good regenerative capacity. So even if a lot of liver is damaged, if it is acute phenomena or acutely it has happened, it gets better very quickly, and in most of the children. Small percentage, I will say less than 5 to 10%, who may require some specific medications, rare kids who may end up hospitalizing or requiring sometimes ICU care also, what we call acute liver failure. That percentage is very small. So the moment you come to know that your child is having some liver disease, don't get disheartened immediately and getting confused and doing wrong things, or I will say start searching yourself to find your own treatment. Please don't do that. So you follow a specialist like pediatric hepatologist or gastroenterologist or a pediatrician, and try to understand what is the nature of the disease and what is going to happen with the kid, and that we can know over the days, because the psychology of the parents is very important for a doctor to treat a kid. If you are understanding as a parent what exactly my child is suffering with, what is going to happen, all the treatment and everything becomes very easy. And as a team, like as a doctor and a parent, we can help the child come out of this issue. So as I said, don't get too much worried, don't get gloomy about the diagnosis of the liver disease. Try to get to the reason of it and the severity of it. How bad is the liver disease? So your doctor will tell by doing some tests that how bad is the liver disease. Okay, so these are the two important factors which we will tell you about the etiology and the future outcome, or how bad is the liver disease. Now the second thing we need to know, it is acute liver disease or it is a chronic liver disease. Most of the time it is acute. Acute means suddenly something has happened which damaged the liver, and liver will should improve over due course of time. If it is not improving, child may need some specific treatment or ICU care sometime. Or it is a chronic liver disease. There can be some underlying genetic issue or autoimmune issue, sometimes viruses like hepatitis B and C, or rarely drug-induced liver injuries also. All these can cause chronic liver disease, which has totally different implications. They may require a lot of workup to know the exact cause, because it is possible, but it is very difficult to pinpoint one diagnosis on first day just seeing the child or few reports. Many of the times we do stepwise investigations, blood test, urine test, or sometimes liver biopsies also, to find the exact cause of the disease. That is a very important step, because as I said in my other videos also, the pediatric liver diseases respond very well to medications many of the times, where in adult diseases, like in adult is suffering from a liver disease when we diagnose maybe say 10 a year, 20 year, 30 year, but that is not the case with kids. It is usually 1 year, 2 year, 3 year, but it is rapidly progressive. So if you find the cause of the problem at right time and you start the treatment, so the disease which was going like this, it can start improving very rapidly. So we need to know the cause and we need to start the right treatment immediately. If the one of the most important things that I want to tell to the parents is, as a parent, we don't even know that our child is suffering from the liver disease for such a long time. So there are some clues. If it is there, don't ignore. If you feel that your child's jaundice is coming and going, it comes and goes, don't ignore it. At least meet once your pediatric gastroenterologist and hepatologist or your pediatrician, just to find why it is happening. Is it a normal phenomena or it is because of some liver problem? Second, if you feel that abdomen is too much distended of your kid, anytime from neonatal, I will say whatever age your kid is, if abdomen is too much distended, you feel no, it is always tight, or whenever you touch you can feel something hard inside the tummy which is not there inside your tummy or the other siblings, then you must think, is it liver which is big or something like that? Just get a general examination from your pediatrician, just to be out of this confusion. Second, If your child gets hurt and he's bleeding a lot, like after vaccinations, too much bleeding is happening. Whenever he falls or get hurt, the blood clotting is not happening quickly. That is another possibility that child can be having liver disease. Third, when child is having too much of itching over the body. Itching is another thing where bile is not going out of the body because of the liver problem. The other thing is abdomen is too much distended and it is shiny. You can see some fluid, you can feel that some fluid is there, or visible veins or blood vessels over the body. These are some signs which we miss for a very long time because there is no apparent jaundice. So parents must know these signs. Once the diagnosis is a jaundice or liver disease is confirmed, try to know why the disease has happened, what are the medical options do we have, what if it fails, what next. Like very rarely we need to do liver transplant also in the kids, but most of the time they get with. Having all this knowledge and understanding all this point makes this difficult journey easy. Like I always say, whenever a child is having chronic liver disease, or I will say liver disease, it is not an event, it is a kind of journey. So we can make it easy by our understanding and proper efforts so that we can give our kids a happy and healthy life.